Good afternoon, everyone. This is Dr. Raymond Gasky with my intern Heather here. We're going to be today looking at what to do for wrist pain at the thumb and wrist joint. Our first procedure is going to be seeing if we come up with an accurate diagnosis. A common complaint in this area might be osteoarthritis of the wrist joint or another complex called Stenosis Tenosynovitis. With Stenosis Tenosynovitis, there's a simple test called Finklestein's test to determine if we have tendonitis or a synovitis at the extensor tissues for the thumb. So we're going to have the patient tuck that thumb in, close the fingers around it, and we're going to bring the wrist down. Is that uncomfortable?
A little.
If that causes discomfort here, we think that there might be a small amount of inflammation at the wrist joint coming from the tendons. We're going to be doing a little kinesiotaping for that in just a second. Other things we might find problematic is going to be there's going to be a carpal bone called the scaphoid bone that might be subluxating in that region. So, is that uncomfortable when we bring that in? Or a little pop in there?
Mm-hmm.
Sometimes that kind of compressive force on that scaphoid bone when it rides a little bit out of position might cause a little bit of tension and pain there. It could also come from osteoarthritis of that joint right at the wrist. Being that I think our patient is a little too young to blame it on osteoarthritis, we're going to assume that scaphoid's out. So Heather, I'm going to have you stand up for me, and we're going to demonstrate. I'm not going to adjust it yet, but we're going to demonstrate a technique to adjust the scaphoid. We're going to be locking down at that wrist joint, working down right at that scaphoid bone, and we're going to be putting a little thrust in that direction to see if we could reposition the scaphoid. So again, a nice wrist adjustment of the scaphoid might be helpful. We'll sit back down again. Next component of what we're going to do, assuming we didn't need any soft tissue therapy like Graston or active release or corrective exercises, we can do a little bit of kinesiotaping. Try to give the wrist a little support. So let's raise up that thumb for me. We're going to put our tape right down at the tail ends of the thumb. And I'm going to be taking this tape all the way out, so let's keep that thumb nice and up like it's standing. And I'm just going to have you fold that wrist down for me. Good. We're going to fold that tape right down to give a little support to the tissue and the muscles and the tendons that extend that thumb backwards, since these are the ones that are going to need a little bit of help. Now, above and beyond that, we're going to do a nice taping over here to see if we can reduce inflammation at the wrist joint. So, we're going to be taking that tape, we're going to be putting a little stretch on it. Being careful not to cross the crease of the wrist joint, or else it'll be a little unstable taping. It'll come off real easy. And we're just going to be wrapping that tape up and around like a little wrist cuff. We're going to use our tape, back of our tape, to smooth down that kinesiotape to see if we can get the adhesives to bind a little bit better. And again, that's our taping for wrist pain at the thumb and specifically a Stenosis Tenosynovitis. Thank you.